With COVID-19 case counts continuing to mount here in Ross County as well as surrounding counties, the Ross County Health District has shared recommendations on a new mitigation strategy in addition to the Ohio Department of Health's health order to get us through the holiday season and into 2021 as safely as possible and to slow the spread. In a moment, we'll hear from Ross County Health Commissioner Garrett Guillozet, also Adena Health Systems, Dr. Kirk Tucker, and Dr. Christopher Brown, the medical director for Ross County. That's coming up in just a moment. Husqvarna, zero turns, lawn tractors, walk-behinds, handhelds, and auto mowers. All at Hometown Motors Incorporated. Buy it here, get it serviced here. Hometown Motors Incorporated, 818 Eastern Avenue, Chillicothe.
My name is Garrett Guillozet, and I'm the Health Commissioner here for the Ross County Health District. With our staff we have present today, we have Dr. Kirk Tucker, who is the Chief Clinical Officer for the Adena Health System, several of our Board of Health members, and guests and local media as well. So thank you for all joining us today. This is really a press conference to update the community and our county on what we're seeing regarding our COVID-19 response, as well as laying out a few mitigation strategies that we believe will help get the response in a better place moving forward over the next month to several months. So if you have questions, what I would like you to do is to type your name in the chat, and then after we are done presenting our information, we'll call on you to ask your questions. Until then, if you could remain muted, that would be helpful for us as well as we navigate this virtual press conference on our end. So with that, I'll just get started by reading a brief statement and then share some data with you, and then turn it over to Dr. Tucker to share how the COVID-19 pandemic is affecting the Adena Health System. So, okay, thank you. As our cases continue to increase, and as we face an uncertainty with our healthcare system capacity and staffing, we all must work to ensure that we are reducing our contacts and limiting our exposure to other individuals. Over the last several weeks, RCHD has seen a steady increase in the number of COVID-19 cases in our community. Since November 1st, we have received a total of 940 new COVID-19 cases, bringing our current total to 2,586 cases. Additionally, our incidence rate on October 1st was 69.13 cases per 100,000. Today, our incidence rate is 426.53 cases per 100,000. That makes Ross County 4 times the CDC's definition of high incidence rate. Additionally, we're sad to report that we've lost a total of 63 Ross County residents due to COVID-19. We know that anytime people gather, there is a higher risk of exposure and spread of COVID-19. Case numbers are one factor that we must take into consideration when developing guidance and recommendations, but so is the strain on our regional healthcare system. Outpatient visits, emergency department visits, hospital admissions, intensive care bed availability in our region are all reaching critical levels. Additionally, as we progress through this pandemic, laboratory reporting times are beginning to increase. We are urging anyone that has been tested and who is symptomatic to begin to self-isolate at home and continue to isolate until they receive their test results. If the test is negative, please remain in isolation until the health district contacts you with further instruction. Additionally, all businesses and retail establishments must follow the director's order regarding face coverings. The order requires that all employees and customers wear facial coverings at all times when in retail business locations. Additionally, it requires retailers to post signage at all entrances indicating that masks are required and to display a maximum capacity that assures individuals are able to stay 6 feet apart. They also must designate an on-site compliance officer for each shift during normal business hours. The health district continues to follow the direction of the state, the Ohio Department of Health, and the CDC. Our responsibility is to provide recommendations to our community based on what is occurring within our jurisdiction. We have continually provided recommendations to our schools, community leaders, and businesses regarding the situation in our jurisdiction. It is important to note that our recommendations are not public health orders. However, orders have been issued by the Ohio Department of Health and can be enforced by state and local law enforcement. Violations of these orders are considered a misdemeanor of the second degree, which can include a fine of not more than $750 or not more than 90 days in jail, or both. Lastly, in addition to the state orders, the Ross County Health District is making the following recommendations and advisories for Ross County until January 1, 2021, unless otherwise extended. 1. Schools are recommended to cease all extracurricular activities and youth sporting events. This includes school sports, club sports, travel sports, and other school-related activities. 2. Community festivals, events, and gatherings should be suspended. 3. Businesses and government offices are strongly advised to have all staff work from home and implement teleworking as necessary. 4. Churches and other houses of worship are strongly advised not to meet in person and to use online or drive-in options. 5. Community, governmental, social, and other similar government organizational meetings are strongly advised to be held virtually. And lastly, most importantly, all residents are encouraged not to gather with people outside their households. It is imperative that individuals take personal responsibility for their actions. Individuals should not be congregating with people who live outside their homes. We encourage all people and businesses to follow the Health District's recommendation and all orders from the Ohio Department of Health to reduce the spread and lessen the burden of COVID-19 on our community. For the sake of your health, your family's health, and the wellness of our county, we ask that you please take this phase of the pandemic more seriously than ever. The difficult decisions and actions we take now will only help us over the remaining course of these pandemic. At this time, I would like to turn it over to Dr. Tucker to really speak about what is going on with Adena and how are they progressing during the pandemic. Dr. Tucker, thanks for being with us today.
Thank you, Garrett. I appreciate the opportunity. Hello, everybody. My name's Kirk Tucker. I'm an internal medicine physician and the Chief Clinical Officer of Adena Health. We serve a large footprint down here, 9 counties total, with obviously the main hospital here in Chillicothe with most of you all. What we have seen here at the health system since this began really back in March and April has been a series of 3 waves, or what we've kind of labeled surges, although the first 2 pale in comparison to what's happening now. That first surge was when the virus first became present across the nation and we started to see our first cases here. Certainly the entire country and the state went into a lockdown and resulted in a downward swing in the incidence of viral infections. The second surge began when the state began to open up regular activities and lifting restrictions really in June, and the second surge began. Similar processes put in place, testing became more available, tracking of those exposed and affected, I think was getting more efficient. And then this final surge, I can only attribute to potentially returning to school and colleges and those types of transmissions, people further sort of letting down their guard. So as I said, this surge that we're in right now has dealt us the most significant blow. And I'm on calls daily with not only hospitals here in Southern Ohio like SOMC and Holzer, Fayette, but with the entire Zone 2, which is Columbus, Southern, and Southeastern Ohio. And what they are experiencing in Columbus right now is absolutely unprecedented. With over 1,000 patients admitted daily, we're setting records for people with COVID in the ICU and people with COVID on the ventilator. And what's important to understand is it's really not been, at least to date, a bed capacity issue or a room capacity issue. It's become a staffing issue. Having adequate nursing staff, physician staff available to care for an ever-growing demand of patients with COVID. Here at Adena, we peaked out at around 40 inpatients with coronavirus. Today we are down to 38. Last night we were back up to 38 again, so kind of reaching our peak. When we need to, we do overflow into different areas of the hospital, but it does require us to call in many times emergency staffing. Today we have 3 people on ventilators with coronavirus. That fluctuates usually between 3, 6 or so. I round up there several times a week, and more often than not, when I'm on the COVID unit, we have somebody that's dying of coronavirus that is going through the grieving process with their family and coming off the ventilator for the last time. Today we have 7 inpatient nurses and 3 doctors that are out with coronavirus, a total of 59 caregivers off work in total. We peaked out at 14 inpatient nurses off at one point in time. So staffing shortages again are our weakest link. At this point, we have 1 hospitalized employee sick enough to be in the hospital. So these sick caregivers have been our biggest challenge. The volumes clearly surging to a level that makes me fear what will come following the Thanksgiving holiday, where I know many folks gathered. And the real point of emphasis that I want to put forth today on this forum is sort of a no-no word in medicine, and it's called rationing. And what that basically means is when something happens, be it a catastrophic event that, like the RCI incident, or whether it's a months-long event like a pandemic, eventually the capabilities of health systems, locally, statewide, nationwide, can be reached. And what ends up happening is then the care of those patients gets spread thinner and thinner amongst nursing and physician staff. And the best way, I think, to emphasize the results of this were what happened in Manhattan. If you guys remember, in late spring and early summer in New York City, the death rate, it wasn't a more dangerous virus that was going through Manhattan at the time. The reason there were 1,000 a day dying in Manhattan, and refrigerator trucks lining up outside of hospitals, and potter's fields being dug in local places to put bodies until they could figure out where to send them, was because the health systems in that region became overwhelmed, and they had to make decisions about who was going to get full care and who couldn't get the full amount of care support. That is where no health system, region, community, whatever, ever wants to get to. And we are at very high risk of reaching that level right now. In Southern Ohio and Central Ohio, I know Cleveland is just as bad as everywhere else, and Cincinnati as well. So this has really put a strain on the health system's operations. Some systems in Columbus are having to scale back on elective surgical procedures. These are things that people need to have done. The health system doesn't have enough nurses in order to do them, so they have to put those off while they divert that nursing staff to care for the ever-growing number of people coming through the hospital doors with coronavirus. So that's where we're at today. I don't really anticipate, again, with the holiday and the travel season, people being indoor for winter. It's snowing outside right now. Schools are, for the most part, spread around the area, still in session. It looks like the probability states it's going to get worse before it gets better. The vaccine is on the horizon. There's almost daily, weekly good news on the vaccine. But by the time enough of that gets here and makes its way through healthcare workers, the sick elderly in nursing homes, then eventually out to the seniors in our community, and then on down, it will be months. So before your average Joe, 40-year-old is getting a coronavirus vaccine probably next June. So that's kind of where we stand right now, Garrett.
I appreciate that update. That's very helpful. And I think, Dr. Tucker, that helps put our situation in perspective. A lot of individuals, as I mentioned, think case counts are our driving factor in some of these mitigation strategies, but we know case counts are simply a small part of the bigger puzzle on how it's actually impacting our community. And when our healthcare capacity and staffing become problematic, That is really the last resort we have to get people to really buy in, take personal responsibility, and make those tough decisions to stay home, to stay with their loved ones in their house, and to not congregate with people outside their home. So I certainly appreciate that. At the Health District, we continue to wish you all well, to stay safe as best you can. One part I would like to bring up is that we often get a lot of questions about asymptomatic or symptomatic individuals. We continue to see cases both symptomatically and asymptomatically, but the risk of transmission there's not a great difference between the risk. So if people are able to get tested, we are encouraging those with symptoms to get tested and to remain in isolation until their isolation period is up. Here at Ross County, we are still doing contact tracing. We are still doing our case investigations. It is nearly an around the clock operation, and that has not stopped. So I'm very proud of what our team is able to accomplish with the increased cases that we've seen over the last several months. Just to put it into perspective, in October, the Health District had 719 cases. Already without today's number in November, we've had 957 cases. The highest month before that was August, where we had 325. So you can see this has dramatically ramped up over the last several months. And unfortunately, there is no sign of relief anytime soon. The vaccine is coming, but as Dr. Tucker stated, it's months away from the general population to actually have access to that. So these mitigation strategies that the Health District released today, these recommendations are paramount to us getting this under control in our county, to really stopping this hospital staffing and capacity issue from becoming life or death for individuals. And so we cannot stress it enough. These recommendations are based in science. They are repeated across the country. We know that if people stay in, limit their contact with other individuals, this will make a difference. So we are urging all residents of our county to heed our recommendations and to really follow those so we can all make it through to the other side of the pandemic as quickly and as safely as possible. Dr. Tucker, do you have anything you would like to add before we open it up for questions for our guests?
Nothing specifically other than really this is in the public's hands at this point in time. As far as the trajectory and what we will face in the future. We know a couple of very fundamental things about this virus. One of them is it loves indoor spaces with people. It absolutely transmits like a wildfire in that situation. Certainly things like washing your hands, wearing masks, and staying separate from people are all very important. But gathering even with a group of people who all say, hey, I feel fine, I haven't been around anybody with this. The implicit danger is in the fact that when young people get this sometimes, especially children, they don't ever have any symptoms. So you can have folks there that all say they feel fine, and this virus can be given to somebody who either has risk factors or is one of the unfortunate ones who, when they get it, even as a younger, relatively low risk person, tends to get extremely sick with this. You just don't know. So you could line up 4 35-year-old men with no major risk factors. One of them can get it and get so extremely sick that they require a ventilator and a prolonged hospital stay, and even threatens their survival. So to gamble with that is just too much. So the masks, I know there's a lot out there about masks. Do they work? Do they not work? The way I think about it is at worst, it doesn't work, but it's a nuisance, right? It hurts your ears, and I can't read people's mouths. And sometimes I feel like I'm suffocating with the thing on. But at best, it might protect you to a degree. And if you are a carrier of the virus and spreading it, it might protect others around you. So again, at worst, being a nuisance, everybody, please, when you're out in public, put on a face covering and do your best to help out the health department and your local health systems. And not to mention things like local EMS, which right now I just got off a call this morning in Columbus. They're overwhelmed. They've got sick EMS workers out. They don't have people to transport patients to the hospital. This is just out there and everywhere. And right down to it, the argument about wanting to keep businesses open and thriving and not have them go out of business, the best way we can do that is to minimize the spread of the virus so that we can all go out and go to a place to sit down and eat safely, or to go shop for the holidays. The best way to do that is to follow the guidelines from the health department, wear our masks when we're out doing that. And if you walk into a store and it's jam-packed and people have their masks down around their neck, maybe come back later in the evening and see if you can get in there with there being less of a crowd. This virus loves crowded indoor places. It absolutely loves it.
Absolutely. And I think that's equally important to discuss testing. As we've seen, testing capacity continues to be an issue. A lot of the supplies that are needed for rapid antigen tests just aren't readily available anymore. And so as people revert back to more PCR testing, the nasopharyngeal swabs, we are seeing an increased time in laboratory reporting for those tests. So we are seeing up to 6 to 7 days by the time the sample is taken to test results being given back to that individual and then being reported here at the local health department. So that lag time is extremely important to make sure that if you get tested, stay home until you get your test results. And if you are positive, the health district will be reaching out to you.
Garrett, would it be possible for me to share something on my screen with the viewers?
I believe you do have permission, yes.
Okay, I'm going to see if I can get this. This is something that not a lot of people have access to, but is shared coming out of Columbus. This is the COVID inpatient census for all of Zone 2, which is regions 4, 7, and 8. That's Columbus, Southern, and Southeastern Ohio, which is our collaborative zone. This is since this began early in April. And again, you see that first peak. And this is where we were opening the Columbus Convention Center. If you guys remember, they were putting cots in there and getting ready to call in the military. We were at 350. Then the fall off, and then the June reopening, not quite as bad. And then right here, late August, early September, this began to happen. And this little dip right here was the Thanksgiving holiday, and then the Friday, Saturday, and Sunday to follow. This is the number of people admitted throughout this zone with coronavirus is now over 1,000, probably 1,100. This is as of this morning. This is the number of people admitted to the ICU and the people admitted to the hospital on a ventilator, all of them setting records. This graph in my mind shows me just how serious and out of control the last 6 or 8 weeks has gotten. So I would implore everybody to burn this graph into your memory, because it's not going to take too much more of this before hospitals are going to have to start looking at seriously spreading out care a little bit more evenly. And God forbid we get to such a day, but this trajectory just does not look promising, especially following a gathering holiday. So thank you for letting me share that.
Absolutely. Thank you for sharing that with us. I think that's an important number to keep in mind. And that information is exactly why we're holding this press conference, to continue to bring to light that we each have a responsibility to play into making sure those lines aren't going up any further. So with that, we have received a couple questions. I'll call on your name and feel free to unmute and you can ask the question. That's fine. Dan Ramey has a question for Dr. Tucker.
Thanks for doing this, and thanks for what you folks are doing to help us get through this as well. My question is in regards to capacity. I know you and I talked back in April about making the PACCAR Center available. Should your capacity stretch over to that point and you continue to have difficulty with staffing, what are your options? I mean, is that where the Ohio National Guard steps in at that point?
Yeah, thank you, Dan. That's actually a good question. So I gave the order about 2 weeks ago to reopen the PACCAR. All of the cots, beds, IV poles, arranged for oxygen supply to be put back in place, anticipating that the time was here. This was the real deal. We were going to need it. We don't have patients over there yet, but it stands ready. As far as staffing, my chief operating officer, which is my clinical operating colleague here, made a very forward-thinking decision a few weeks ago and reached out to a nationwide emergency staffing agency that provides RN staffing in the event of a major catastrophe like a hurricane. And the health system applied for 100 registered nurses. We threw a Hail Mary And as of today, I think have 40 emergency staffing nurses starting here throughout the health system to help offload some of the overwhelmed and burned out nursing staff that's been serving now for weeks and weeks and weeks on end. We've got folks here that have been working 7 days straight. Some work all day long in one setting and go to another setting and then work all night long. I don't know how they do it, but those emergency staffing nurses will be with us for at least 4 weeks, and then I believe we can elect to continue based on need following that. Now, robbing Peter to pay Paul, those nurses came from somewhere that somebody probably after us had a similar thought and then, made a request and found that that they had sort of been gobbled up. So, it might help our region here, but certainly somewhere else is then suffers from short staffing. Yes, the National Guard is sort of that last ditch option for them to bring people in, but they only have a certain capacity as well. So when it comes to actually what we would do should we start to flow into PACCAR, I like to tell people it becomes a different kind of medicine. It's battlefield medicine. It's no longer concierge medicine, your own private room, bathroom, etc. We take the less ill people here on campus. You get put in a cot. You're wearing oxygen. Everybody gets a ham sandwich. We escort you to the one bathroom over there. It's not pretty. It's like what everybody remembers from MASH. It's not like your standard hospitalization. So that's where a nurse might end up having to take care of a row of 10 or 15 patients, one doctor, a room of 30 or 40 patients. Documentation goes by the wayside. You kind of quit messing around with a computer and you just practice pure medicine. If people get sicker, they get shuffled up to the actual hospital building, and that displaces somebody else then from the floor. So you take the least sick from the floor back out to the other care areas. So you end up sort of with this stacked level of acuity, the least acute in one location all the way through the COVID ICU requiring intubation and ventilators. So we're not operating that way now, but we have put in place all of the plans and the practices for how we would do that if things continue to get worse.
And once again, thank you for all you're doing for our community and for the people who are dealing with coronavirus. I guess the question, first of all, what are you doing for the surge from Thanksgiving? What can you do to prepare? And then similar question, as we move toward Christmas and the Christmas holidays, what can you do to prepare? I know what you've asked us to do, but you've touched on it a little bit, Dr. Tucker did, but what are the preparations to deal as we head toward all these holiday gatherings?
So we know historically, each time we've had a holiday, we've always seen an uptick in cases. That's not a secret. I mean, we can look back through the beginning of the year. That's been consistent. I am extremely concerned that Thanksgiving will pose the largest increase in cases that our state has seen to date. Thanksgiving travel broke some records this year based on all of the information that I've seen, and that really makes me nervous. Internally at the health district, we continue to ramp up staffing as much as we can. We continue to do our case investigations and contact tracing. Those tools actually do make a difference. If we contact individuals who are positive and they remain in isolation, they are far less likely to transmit the illness to anyone else, as well as their contacts. So quarantine, while I understand it is a burden, I get that, but it is imperative that that is a tool we still have to make sure that we're not spreading it amongst our community that we normally would if those individuals were not in quarantine. So that's what we continue to do here at the health district. We push out messaging. We're working with our partners and leaders to really reiterate the recommendations we're making today that we know will make a difference if they are heeded by the community.
And Dr. Tucker, if you could just address as we move toward Christmas, what are your concerns as you know what you're dealing with now, but it looks like people really have to heed what you're saying.
Yeah, there's been a lot of messaging going out from the beginning of this with Facebook Live events and to try to communicate the importance of following these simple guidelines. unfortunately, I think it's a combination of the mixed messaging that we've received from the beginning. Even the CDC can be faulted in that. That some folks have kind of taken the other course. They've taken path B. And, I talked to my neighbor over the weekend. He said, I'm just sick of this. The Ohio State game was canceled. And I could tell he was just done with it. And I think we have to understand that the sentiment of some folks is, it's been 8 months of slugging it away with this thing. And I believe it's the opinion of some folks just to get it over with, exposure or not. And because we live in a free country and we don't have the ability to really mandate things like, they did in China or Taiwan or other nations that have sort of stronger ability for government decrees to have action behind them, that I think no matter what we say, that things are going to continue to spread until that vaccine gets out there and enough people in the populace get that vaccine, taking the transmission rate down below that sort of critical mass, at which continued spread of the virus is no longer sustainable. But that's going to be looking spring, summerish. I don't really know what to tell folks other than the fact that I know the holiday was different this year. For Thanksgiving, it was my wife and I and 3 sons. I put some food on my father's front porch. He did not want visitors. Other family members chose to do other things, but it was a different Thanksgiving. But I think also neat for other reasons. So it might be an opportunity one year to have a different kind of Christmas get together. Certainly if it could save family members' lives, that would be worth it to me. I've heard now so many stories of people and gatherings and people going to the funerals. And we had a local case down here, 17 family members at a funeral, 14 got the virus at this funeral, and 2 of those 14 died. I just don't see how that's worth it for something like that. Another family gathering, it was just grandparents, the kids, and some grandchildren. Somebody came home from college. They all ended up getting coronavirus. I know the grandfather was in the emergency department at least twice. I think he was even hospitalized. And again, these people were like, hey, we know these folks. They don't have symptoms. I think we'll be fine. It's been 8 months. Let's get together. And they did. And it's just like that. And I have to kind of agree with my dad on this one. He's like, hey, there'll be time next summer to get together and do cookouts or whatever. Thanksgiving's just going to be weird this year. So I agree with everybody. I mean, I miss it too, but it is what it is.
I think that's an excellent point. And, I said this in our community letter, Dr. Brown and myself to our residents, is that this is the year that traditions need to be put on pause. We are weary at the health district just as much as everyone else. We've been living and breathing this since day one. And so we understand, but I think the call to action is that this is not a local health department pandemic or a health system pandemic. This is a pandemic that affects everyone. Business leaders, community officials, schools, elected officials. We each have a role to play to help with our messaging and to really make sure that we are, living by example and doing the things that we're asking individuals to do. That's why I think it's important that we follow these community recommendations. We know that if we keep people apart and keep people in their homes the best we can still continue to support our businesses and keep things open without going that next step. We do have a Dr. Christopher Brown, the Ross County Medical Director, is now on the call. Dr. Brown, do you have anything you'd like to add? We've just finished up taking a few questions.
Okay. Yeah, and I do apologize. I actually had to do some clinical work. We have some dialysis patients that need to be seen virtually, of course, because of the pandemic. So, I mean, of course, we'd had this conversation before, and I've, of course, talked with Tucker as well regarding the seriousness of, the COVID-19 pandemic and the need for, ongoing diligence in terms of, trying to manage with going through this pandemic. I know it's stressful. I'm not, in addition to being the medical director, I also work in the hospital. So when that surge comes, like I said, I'm definitely there, seeing some of the patients as well. So we definitely all feel it. So it's important to, continue to wear those masks and continue to find, creative ways to kind of interact with family and things of nature. So.
Great. Thank you, Dr. Brown. Are there any additional questions for the panel today? So we'll be following up our recommendations with the media release, highlighting our talking points today. Again, to reiterate, these are recommendations from the Ross County Health District. Just to make sure that that's very clear. If there are any comments or questions afterward, please reach out to the Health District for more information. We thank you all for tuning in today and being supporters of the Health District. So thank you all very much and have a great day.